Assalamu alaikum. Now I would like to discuss about posterior hip dislocation. In posterior hip dislocation and PHD, there may be anterior hip dislocation also, but this one is very common. And another one is femoral neck fracture or intertrochanteric fracture. In posterior hip dislocation, hip is shortened and internally rotated. Hip is shortened and internally rotated. But in femoral neck fracture or intertrochanteric fracture, again femoral head is shortened, but in this case it is externally rotated. Externally rotated. So fear femoral head, there is external rotation. Femoral head is externally rotated, but posterior hip dislocation, there is internal rotation. These things you have to remember to deal with the question that if a patient, if in examination you find that his femoral head is shortened and internally rotated, that is posterior hip dislocation, and femoral head is shortened but it is externally rotated, then it is femoral neck fracture and intertrochanteric fracture. And these shorten and external rotation due to contraction of the psoas and iliacus muscle without normal acetabular counter force. So due to contraction of the psoas and iliacus. But in posterior hip dislocation, there may be shortened and internally rotated. There may be other feature too. These this can cause This posterior hip dislocation itself can leave the leg in fixed position. In addition, it runs close to the posterior aspect of the hip joint, uh, the sciatic nerve, which branches into the common fibular or peroneal and tibial nerve, and you may get the problem in those distribution like weakness in the knee flexion causes sciatic nerve. Weakness of the knee flexion happens due to sciatic nerve. So there is weakness of the knee flexion. There may be ankle dorsiflexion due to involvement of the common fibular nerve, and there is decreased ankle reflex there due to involvement of tibial nerve. There is confusion, again one confusion, that anterior hip dislocation and posterior hip dislocation. In anterior hip dislocation and in posterior hip dislocation, in both cases, in anterior hip dislocation there is shortening and internal rotation, but the problem here that in here the hip is in posterior hip dislocation and anterior hip dislocation, there is again shortened and externally rotated, but posterior hip dislocation is shortened and internally rotated. There is one difference. And femoral, it just like anterior hip dislocation may be confused with femoral neck and intertrochanteric fracture, but in here the hip is abducted and externally rotated. there is abduction and external rotation, but in femoral neck fracture there is no abduction. So this is another point. This is a very confusing topic. Hope you enjoy.